Are your blood vessels okay? When you have diabetes, your risk of stroke jumps to 2-3 times higher than normal. But that's not all. In fact, people with certain characteristics might be in an even more dangerous state. Your blood vessels might be starting to clog without you realizing it. To prevent the worst case scenario of suddenly collapsing, losing consciousness, and then we'll share the top 5 characteristics of diabetes patients prone to stroke. Please check until the end to see if these risks apply to you, and those who think I'm fine need to be especially careful. Knowing this right now is the first step in protecting your future. If you find this video helpful, please hit the subscribe button and give us a thumbs up. The first of our top 5 characteristics of diabetes patients prone to stroke is poor blood sugar control over a long period. Are you leaving high blood sugar levels unchecked? When blood sugar control isn't going well for a long time, your blood vessels deteriorate and arteriosclerosis progressively worsens. This is just like rusty pipes crumbling from the inside. Damage accumulates on the inside of blood vessels, leading to the frightening situation where blood flow suddenly stops and oxygen can't reach the brain. Are you letting your guard down thinking, it's okay if my blood sugar is a bit high lately? That carelessness might steal your future, but don't worry, there's still time. Let's review your blood sugar control right now. Here's my translation. I'll maintain a natural conversational tone while preserving the medical accuracy. The second of our top 5 characteristics of diabetes patients prone to stroke is having high blood pressure. It's not just about blood sugar. High blood pressure is also a critical warning sign for stroke. When blood pressure is high, your blood vessel walls are under constant pressure. When combined with diabetes, your vessels become fragile, dramatically increasing the risk of rupture. The risk of cerebral hemorrhage is particularly high, and when symptoms like sudden dizziness, numbness, or consciousness disturbance appear, blood vessels in your brain might have already burst. Are you thinking, it's okay because my blood pressure is just a little high? That little could be fatal. Let's measure your blood pressure now and start proper management. The third characteristic is having dyslipidemia. Those prone to vessel blockage need to be especially careful. When cholesterol is high, plaque, fatty deposits, accumulates inside your vessels, eventually shutting off blood flow completely. This triggers cerebral infarction. Diabetic patients are already more susceptible to vessel damage, making atherosclerosis progress much more easily than in healthy people. Are you thinking, my health check showed high cholesterol but I'm still okay? That still okay might lead to sudden paralysis or speech disorders. Let's protect your vessels through dietary improvements, exercise, and proper treatment. The fourth characteristic is having heart conditions like atrial fibrillation. Is your heart rhythm irregular? We know that people with diabetes often have arrhythmias, especially atrial fibrillation. Atrial fibrillation means your heart beats irregularly, preventing smooth blood flow. This causes blood to clot in your heart, and these clots can travel to your brain, causing embolic stroke. Are you thinking, I have palpitations, but I can probably ignore them? If left untreated, blood clots might suddenly travel to your brain and cause a stroke. Early examination and proper treatment of palpitations and arrhythmias will protect your life. The fifth of our top 5 characteristics of diabetes patients prone to stroke is obesity and lack of exercise. Are you moving around, or are you just sitting all day? Lack of exercise and obesity not only accelerate the worsening of diabetes, but also dramatically increase the risk of stroke. Especially people with visceral fat obesity are prone to atherosclerosis, making their brain vessels more likely to become blocked. I don't have time. Exercise is troublesome. If you continue to ignore it with these thoughts, your future self will regret it. But a little exercise will save your future self. Why not start with just 10 minutes of walking per day? That anxiety you're feeling now, it's not an overreaction at all. Even if you think, I'm still fine, people with diabetes are said to have a 2-3 times higher risk of stroke. Even if there are no symptoms now, you could suddenly lose control of your body one day. Recently, I sometimes feel numbness in my limbs, but it's probably nothing. I sometimes feel unsteady, but maybe it's just age. Are you ignoring these signs? These small discomforts might be signs of an impending stroke. What if you have a stroke? What if one morning when you wake up, half of your body won't move? What if you want to talk with your precious family, but the words won't come out properly? Even if you survive, you might be paralyzed or bedridden, leading to lifelong regret, but it's not too late now. What if you leave things as they are? One day, you might suddenly lose consciousness and never wake up again. Everything was normal just yesterday. I never thought this would happen to me. But stroke won't wait. Even if you survive, you might become paralyzed on one side and never walk freely again. You might lose your ability to speak and communicate with your family. You might need help from others for basic activities like using the bathroom or eating. If only I had been more careful earlier. Why did I ignore the signs back then? To avoid such regrets, let's start taking action now. Let's review the top 5 characteristics of diabetes patients prone to stroke. We discussed today poor long-term blood sugar control, having high blood pressure, having dyslipidemia, having heart conditions like atrial fibrillation, and being obese or lacking exercise. If these risks apply to you, take action immediately. But where should I start? First, maintain strict blood sugar control. But diet management is difficult. For such people, start by cutting down on sugary drinks. Just doing this can prevent sudden blood sugar spikes. Next, regularly check your blood pressure and cholesterol. Even if you don't have time to go to the hospital, just measuring blood pressure at home can help detect stroke risk early. Then establish exercise habits. You don't need intense exercise. Just walk 10 minutes every day. Even this can improve blood flow and reduce stroke risk. Furthermore, quit smoking. Smoking destroys your blood vessels. It's hard to quit right now. Then start by reducing 1 cigarette. Small steps can make big changes in your future. Finally, manage stress. I'm too busy to relieve stress. Even just deep breathing is okay for such people. Just 30 seconds of deep breathing can calm your blood pressure and reduce strain on your heart and vessels. To avoid thinking, if only I had known earlier. Let's start with what we can do now. Even a small step becomes a path to protecting your future health. What's important is starting today. If you found this video helpful, please give us a thumbs up and subscribe to our channel so you won't miss future health information. Let's meet again in the next video to protect your health.